So our next presenter is Maya, and she is doing her presentation on medical education and its application to individuals with intellectual disabilities. So you can start whenever you're ready.
So my capstone project is titled Medical Education and its Application to Individuals with Intellectual Disabilities. So to start, you need to answer the question of what is an intellectual disability. So the American Association on Intellectual and Developmental Disabilities defines an intellectual disability as a disability characterized by significant limitations in both intellectual functioning and in adaptive behavior, which covers many everyday social and practical skills. This disability originates before the age of 18. So while this is what an intellectual disability is defined as, it really must be understood that this definition varies immensely within the intellectual disability community. So in my interviews, I've met extremely independent individuals, and I've also met some who might require more assistance or are nonverbal. So the information and suggestions that I do include are directed towards those who find it helpful to their personal need, and they're not a suggestion for everyone who's labeled with the term intellectual disability. So how did I come up with my topic in the first place? It's kind of just been a combination of interests and things that I've been involved in. So I have memories of spending time at Sarah Inc., which is a nonprofit organization that helps people with intellectual and developmental disabilities. So I have memories there from when I was young because my aunt used to work there and I would go there with her. And so now that I'm older, I've been going and volunteering there in my free time. And so I bring crafts and I play games with them. And I've made a lot of friends in those programs. So it's just really been this open and welcoming community. And then I've also had this fascination with medicine. So when I was young, I really enjoyed going to the dentist for some strange reason. And so I would always ask about like medical tools and how doctors would go about doing certain procedures. And so then that's where my interest came from. And then my specific topic came up kind of I'd say about a year ago, where I had to get an MRI. And so when I was lying there, I was really thinking about how some people experience difficulties in getting MRIs done. For example, my mom is claustrophobic. And so then if someone was claustrophobic or sensitive to loud noises or had this difficulty staying still for a long period of time, then really how would they still be able to be treated? So then I took the idea of an MRI machine and evolved it into how medical necessities in general can be frightening to people. And I thought about how a population like the intellectual disability population might feel uncomfortable in medical environments. And so really how would medical professionals make people with intellectual disability feel more comfortable? So my capstone kind of went through like a 3-stage process. So first I interviewed people with intellectual disabilities, and this included their family members and caregivers. And I kind of just heard about different difficulties and successes they had experienced in the medical field. And then I interviewed medical professionals as well as professionals just in the field of intellectual disabilities. And so then I brought up different concerns that I had received from previous interviews, and I just really learned about ways that medical providers could adapt to help their patients' specific needs. And then from there, I took results from all of my interviews and I tried to find possible adaptations and solutions to really make medical care an easier process for people with intellectual disabilities. And then throughout this whole process, I also did a lot of independent research to really fully submerge myself in my topic. I will say that during my research, I was given an opportunity to shadow a doctor who specializes in intellectual disabilities, specifically Down syndrome. And so I was hoping to get this new perspective to bring to my capstone project through this experience, but for obvious reasons that was not able to happen. But I am still happy that I was able to gather the interviews that I have, and then I hope to still have this opportunity in the future to go shadow him. So some of the major difficulties that have been brought to my attention regard the check-in situations. Also, there's sensory and balance difficulties, and then insurance coverage, finding support, and then there's also this lack of communication. So I took a couple of these and I tried to come up with adaptations or solutions that could help people. So the first difficulty is check-in difficulties. There seems to be this lack of accommodation. Also, receptionists are not always trained in how to handle certain situations. And then there's just a lot of chaos involved in entering a medical setting at some times. So some adaptations or solutions could be that medical practices could incorporate a more private waiting area for patients that would prefer an area just for themselves and their family. Also, receptionists could have age-appropriate comfort items. So an example could be like a stuffed animal or a coloring activity to keep the patient feeling welcomed and so that they associate the doctor's office with this positive experience. Also, receptionists should learn to be tolerant of people who come in with many personal items from their home. And then you could also offer mentors to explain how appointments will go, and you can incorporate videos and pictures with this. So I went to get my wisdom teeth out and I sat down in the dental chair and they gave me an iPad. And on the iPad was a video that explained the whole process and the procedure, and that made me feel more comfortable. So you could try incorporating something like that. And then also paperwork can just be received and filled out prior to the appointment, and that will just eliminate this additional waiting time. So the next difficulty is sensory and balance problems. So for instance, taking vitals can be uncomfortable and new, and also the patient may have specific phobias such as say a fear of heights or metal. And then there also can be anxieties related to noise, movement, or lights. So to go about this, you can provide an orientation where there's a run through and an explanation of the appointment before the actual appointment date. I will say that insurance has been an obstacle to accommodate something like this, so it would have to depend on how your insurance deals with that. And then if the patient wishes, medical offices could offer, say, morning appointments that are adapted to have dimmed lights and fewer patients. And this is similar to services they have now with COVID-19, where older people are allowed to go into the grocery store earlier in the day if they feel this is more comfortable, but it really just is a personal choice and how they feel most comfortable. And then music, like a music therapy. If the patient responds well to this, they can be offered music or bring music from their home. And then I also came up with the idea of offering a vital sensory kit. And this would be something that they can take home and that they're able to get comfortable with and used to. So this might include, say, a blood pressure cuff and a stethoscope, because those are two very common tools used in a medical environment. And then anti-anxiety medication. This would likely be more of a last case scenario and something agreed upon by the patient and the doctor with the patient's best interest in mind, of course. So it's not always preferred, but it is an option for if you need that. So the next difficulty is just finding support. So there are certain medical conditions that are really not fully understood or specialized in. Also, there tends to be sometimes this lack of empathy in patients and there's a difficulty developing this positive relationship between the patient and doctor as they only see each other so often. And then also scheduling and getting to appointments can cause difficulties as well. So adaptations and solutions could be that if it's possible, you can schedule an appointment where the patient can meet the doctor before vitals or exams are done. And this will just help develop like a very safe space to have a discussion and allow a positive relationship to form. And then they have systems like these now, but you can set up a system where the medical providers can call or text the patient, reminding them of when their appointment is approaching. So there also seems to be a difficulty with communication. So medical professionals may lack patience or time, and they tend to speak through the patient's family or caregiver rather than to the patient themselves. And so the patient is not really always understood or taken seriously. So you could allow a nurse or a trained volunteer to come speak with the patient in order to give the patient more time to express their concerns and to really communicate prior to the doctor coming in when time may be short. And then also a conversation can be had with the family member or caregiver regarding the best way to approach the patient and what the patient is comfortable with before the appointment. So the topic of telemedicine really applies closely to the world that we live in now with everything made remote. And so the question is, how does this relate to the use of telemedicine even after this pandemic is over? So the solution of telemedicine has had a lot of contrasting opinions. So I thought I'd go into depth on some advantages and disadvantages of this newer form of doctor appointments. So some advantages include that it allows a doctor to be introduced in the comfort of the patient's home. It's also an easier option than going to an actual doctor's office, which can cause additional stress for the patient. It allows the patient to meet with medical professionals outside of their normal geographical area. And then due to the ease of a virtual visit, it can offer more opportunities for the patient to ask questions and concerns. So there's no need to schedule a physical appointment to reach the medical professionals. And then overall, it's just generally more affordable. And then for disadvantages, so I had brought this idea up with a doctor, and he explained how he has used telemedicine before, but he does prefer in-person visits. He explained that virtual visits are not the same as looking at your patient directly and sensing what they need, and so that genuine doctor-to-patient connection is really cut off through telemedicine. And then physical examination is also limited. So it's kind of a matter of explaining to the doctor an issue you have compared to showing them in person, which can lead to a lack of understanding. And then like all technology glitches and connection problems can occur, which impact when you receive care. So my take on telemedicine would be that in-person visits really can never be compromised by telemedicine. However, the use of telemedicine offers opportunities to get care while avoiding outside factors such as finding transportation or getting an appointment. And so I think that the use of telemedicine can be used to provide easy follow-up appointments as well as check-ins. So I kind of raised all of these questions and difficulties regarding the intellectual disability population in the medical field during normal times. And so as my course of study has evolved, the topic of COVID-19 has become more relevant to my topic. So I felt the need to include a little bit on this as well. So there are concerns regarding medical care in cases where certain medical populations may be denied ventilators or specific treatment as the medical field is rationing supplies. And then also the major issue is the discrimination between those who receive medical attention and those who are forced to go without it. So it's just become the civil rights battle regarding the quality of life for vulnerable populations. So kind of like an overview, through research and interviews, I've learned that there is no single approach or answer to address a patient, whether that patient does have an intellectual disability or not. And so the medical field requires flexibility to be able to reach every one of their patients. And so one of the most common difficulties for people with intellectual disabilities is that the medical field is trained to treat diseases, but they disregard the specific individual. So as a community, healthcare needs to provide treatment to the individual, but not the medical label that the individual has been put into. So medical education and training is evolving. So as little as 35 years ago, intellectual disabilities were not addressed in medical school, but fortunately times are changing and there is more support for a new curriculum that introduces medical students to the intellectual disability population. So the National Center for Biotechnology Information took a survey on training, and results show that 85.6% of students had received some sort of educational training in managing those with intellectual disabilities. However, 93.3% thought that they could still benefit from more contact and training with that population. And then from a 2019 article, disability advocates are trying to get medical schools to train their students on how to treat the intellectual disability population. So while they are facing setbacks, their end goal does seem promising. Dr. Holder, who is a disability advocate, says, "What we would hope to see is a long-term improvement in not only the ability of people with intellectual and developmental disabilities to access care, but an improvement in the quality of care." So while there still is progress to be done, there is this promise for the future. Medical education and training is evolving, and medical professionals are becoming more aware of how to accommodate people with intellectual disabilities. Also, technology is acting as an effective resource. So everyone must continue to advocate for the rights of all people with disabilities to really ensure that they have access to quality medical care. So before I end this, I want to leave everyone with some major takeaways that I have learned. So I've really learned that communication is key. You need to be open to adapting and that you should never push a patient. So I'm very fortunate to have had so many opportunities to address difficult topics with people throughout the community. So thank you for listening. And then these are some sources.
Nice job, Maya. I'm just going to open up the chat feature to our participants. So for those of you who are tuning in right now, if you just look at the bottom bar of your Zoom window, and if you click on chat, you can ask any questions that I can recite to Maya, or if you have any comments at all to make, I can read those as well. So I'll give everyone a minute to find that area. I have to say I'm really impressed with the work that you did. I know that the focus of your project was related to, specifically autism and medical information, but I really like how you sort of twisted the information into specifics with COVID and telehealth, and I think that that's really important and worthwhile to hear right now.
Thank you.
Miss Meridian said, "Congratulations, great job." And she asked, what type of doctor's offices did you visit?
I didn't go to specific doctor's offices, but I more had people contact them like through phone because they were a little bit harder to get in contact with. There's one doctor who works at Yale New Haven Health who I was going to shadow, named Dr. Cairns, who I know a lot of you have told me about. And he just is very specific. He has, I think, like 300 patients who have Down syndrome. So, and then I also was able to meet with someone who works at Sarah Inc. So she knows a lot about this population as well.
Pat Bourne said, "Nice job using so many different resources."
Thank you.
If anyone else comments while we're waiting here. So tell us kind of what are next steps for you. Is this an area that you're thinking of studying in the future?
Possibly. I'm really not sure right now. I know that I like topics like this, so that can be something I might pursue in the future, but I really don't know.
What was the most surprising thing that you found in your research, would you say?
Well, I knew communication was a big aspect of like anything really, but every interview I had always explained how there's this lack of communication. So people with intellectual disabilities, I've heard from parents that they go to a doctor's appointment and like the doctor or someone would come in and they'd start talking directly to them and not even really pay attention to their child who was the patient because they thought they couldn't understand. And that just kind of shocked me that there's not more education for people to pay more attention to that.
Yeah, I think that's a really good point, because I think we need to be more mindful of that and realize that, they're hearing what you're saying and they need to be part of that conversation, and it's helpful. I mean, even for children, at a young age, I find that my pediatrician, you know, most of the conversation is between me and the doctor, but he tries to engage my child, even though that she's only 4 years old, because I think it's important for them to learn that and understand that.
Yes.
I don't see any other questions at this point. So I'm going to thank everyone for joining Maya's presentation today.